Question 26. The nurse aide is going to help the client walk from the bed to a chair. What should the nurse aide put on the client's feet? A. Nothing. B. Cloth-soled slippers. C. Rubber-soled slippers or shoes. D. Socks or stockings only. Answer C. Rubber-soled slippers or shoes. Explanation. Preventing a fall is important when helping a client ambulate. Proper footwear should always be worn for any type of walking, even a short distance. Rubber-soled slippers or shoes provide traction to prevent falls. Socks, stockings, or slippers made from fabric can make the client slip or lose balance. Walking in bare feet can lead to foot injuries, which is especially dangerous for diabetic clients. Question 27. Which of the following is not considered to be a way to restrain a client? A. A hand meat. B. Lap buddy or tray. C. A sedative. D. Pain management. Answer D. Pain management. Explanation. A restraint may be either physical or chemical. Its purpose is to protect the client from harming himself or others. Only a physician may order a restraint. Guidelines are strict. A pain medication may help calm the client or relieve behavior associated with severe pain, but it is not in the restraint category. Question 28. The electric shaver that the nurse aide is using to save a client begins to spark and smoke. What should the nurse aide do first? A. Use the roommate's shaver to finish the shave. B. Finish shaving the client as quickly as possible. C. Unplug the shaver. D. Call the nurse in charge. Answer C. Unplug the shaver. Explanation. Whenever giving client care, remember that the patient's safety comes first. Unplugging a malfunctioning device will stop any sparks or smoke. If the client or anyone nearby is on oxygen, the sparks could trigger a fire, so you may need to quickly move people out of the area. After everyone is safe, notify the nurse of the incident. Never use another client's personal items. This is strictly prohibited because of possible infection. Question 29. How many tips does a quad cane base have? A. 4. B. 3. C. 2. D. 1. Answer A. 4. Explanation. A quad cane has 4 tips to provide a broad base to support the client while walking. The client holds the cane in the strong or unaffected side. To walk, place the cane about an arm's length away, with all 4 tips touching the ground at the same time. Step forward with the weak leg, using the cane for stability. Question 30. The most comfortable position for a resident with a respiratory problem is A. Fowlers. B. Prone. C. Lateral. D. Supine. Answer A. Fowlers. Explanation. When a client is having difficulty breathing, Fowler's position can provide relief. When sitting in Fowler's position, the client is upright at 90 degrees, allowing the chest to expand as much as possible. Prone on the abdomen, supine on the back, and lateral on the side are all flat positions, which can make respiratory distress worse. Question 31. The nursing care plan states transfer with mechanical lift. However, the client is very agitated. To transfer the client, the nurse aide should A. Keep wheels unlocked so the lift can move with the client. B. Place the client in the lift. C. Get assistance to move the client. D. Lift the client without the mechanical device. Answer C. Get assistance to move the client. Explanation: client safety is always the top priority. When a patient is not able to cooperate for any reason, do not try to accomplish a task alone. It is important to follow the nursing care plan, including all steps of operating any equipment being used to move or transfer the client. Ask a coworker to help if you have any concerns about keeping the client safe. If the client remains agitated, notify the nurse before proceeding. Question 32. Physical restraints are used most often. A. When staff is short. B. To prevent client injury. C. At the roommate's request. D. At the family's request. Answer B. To prevent client injury. Explanation: physical restraints are devices or equipment that prevent normal movement. Examples are arm or leg restraints, hand mitts, or vest. It is against the law to use restraints unless necessary to treat a client's medical symptoms, or if there is a risk of harming self or others. Restraints are not used for punishment, convenience, or method of control. Either physician's order or the client's consent is required before a restraint can be applied. Question 33. The nurse aide notices that the client's radial cord is draped across a chair in order to reach the nearest outlet. The first thing the nurse aide should do is A. Unplug the radio and ask the client not to use it. B. Tell the client the radio is a safety hazard and take it away. C. Take the radio to the activities room and tell the client to listen to it there. D. See if any changes can be made so that the radio can be plugged in safely. Answer D. See if any changes can be made so that the radio can be plugged in safely. Explanation: all facilities must comply with the electrical safety standards of governmental and accrediting agencies. Client devices, including radios or televisions, must be approved according to the facility's policies. Cords cannot cause any potential hazards, such as tripping or falls. Extension cords are usually not allowed. The nurse aide can help the client find a place for the radio where the cord to be safely plugged in, so the client can continue to enjoy listening. Question 34. To lift an object using good body mechanics, the nurse aide should A. Hold the object away from the body. B. Bend knees and keep back straight. C. Keep both feet close together. D. Lift with abdominal muscles. Answer B. Bend knees and keep back straight. Explanation: it is important to maintain proper spinal position with lifting. The risk of injury to the low back increases when using the back muscles, bending at the waist, twisting, or trying to lift when the load is too heavy. Common injuries associated with lifting are strains, sprains, and herniated disc. For heavy loads, always find another person to help. Question 35. To convert 4 ounces of juice to milliliters, the nurse aide should multiply A. 4 multiply 30 millimeters, B. 4 multiply 10 millimeters, C. 4 multiply 15 millimeters, D. 4 multiply 5 millimeters. Answer A. 4 multiply 30 millimeters. Explanation. When converting millimeters to ounces, remember that 30 millimeters equal 1 ounce. Although an ounce is slightly more, the amounts are considered to be equal by the doctors and pharmacists. Question 36. A client is to be assisted out of bed to sit in a wheelchair. Which action would make this procedure safe? A. Place a pillow on the wheelchair seat. B. Lower both footrest pedals. C. Release the wheel brakes. D. Place the bed in the low position. Answer D. Place the bed in the low position. Explanation. Client safety during transfer begins with the bed in the lowest position. This allows the client to easily reach the floor when standing and pivoting to sit in the wheelchair. The brakes of the wheelchair should be locked and the footrest completely out of the way. Question 37. While making an empty bed, the nurse aide sees that the side rail is broken. The nurse aide should A. Tie the side rail in the bed in the raised position until it is fixed. B. Warn the client to be careful when she gets back into bed. C. Report the broken side rail immediately. D. Wait for the next safety check to report the broken side rail. Answer C. Report the broken side rail immediately. Explanation. Every staff member is responsible for keeping clients safe at all times. This includes monitoring all equipment and reporting when anything needs repair. Never use broken equipment or try to create a temporary solution if equipment is not working properly. Tag the broken bed and move it so that another client can't use it. Replace it immediately with one that has functioning side rails. Question 38. The nurse aide is responsible for all of the following fire prevention measures except A. Being aware of the locations of fire extinguishers. B. Reporting all damaged wiring and/or sockets in clients' rooms. C. Participating in fire drills. D. Taking cigarettes and matches away from all clients and visitors. Answer D. Taking cigarettes and matches away from all clients and visitors. Explanation. While smoking by clients and visitors may not be appropriate, the nurse aide may not take away the cigarettes or matches. However, the nurse aide can certainly report these actions to the charge nurse. The nurse aide should also be familiar with policies regarding smoking or smoking areas to inform smokers if there are designated places. All staff must be aware of fire extinguisher locations and what to do in the event of a fire. Notifying the nurse or maintenance department of any damaged electrical wiring or sockets, as well as faulty electrical equipment, can prevent a fire. Question 39. A client needs to be repositioned but is heavy, and the nurse aide is not sure she can move the client alone. The nurse aide should A. Have the family do it. B. Ask another nurse aide to help. C. Go on to another task. D. Try to move the client alone. Answer B. Ask another nurse aide to help. Explanation. Clients or objects which are heavy should never be moved or lifted by one person. The risk for falls or injuries for both client and nurse aide increases with heavy loads. Ask for assistance before attempting to pull or roll a heavy patient. Use good body mechanics by using your leg muscles to avoid back injury. Question 40. A client is paralyzed on the right side. The nurse aide should place the signaling device A. at the foot of the bed, B. On the right side of the bed near the client's hand. C. On the left side of the bed near the client's hand. D. Under the pillow. Answer C. On the left side of the bed near the client's hand. Explanation. Clients who have had a stroke often have one side weakness or paralysis. They may not be able to use that side of the body or may not even be aware of the affected side. This is called one-side neglect. Rehabilitation services will help the patient recover as well as possible, but as the client's caregiver, you can encourage the client to use the unaffected side by placing the signaling device where the client can reach it to call for assistance. Question 41. Your resident can swim a bowl of soup that is 180 cc of liquid. How many ounces was that? A. 5 ounces. B. 6 ounces. C. 4 ounces. D. 7 ounces. Answer B. 6 ounces. Explanation. 180 cc equals 6 ounces. When converting cubic centimeters cc to ounces oz, remember that 30 cc equal 1 ounce. Although an ounce is slightly more, the amounts are considered to be equal by doctors and pharmacists. Also, 1 cc equal 1 millimeters. Question 42. Which of the following should be reported immediately? A. A blood pressure of 90/40. B. A pulse of 90. C. Respirations of 12. D. Temperature of 99.4. Answer A. A blood pressure of 90/40. Explanation. A low blood pressure, hypertension, is less than 90/60. Only one of the numbers has to be lower to be considered hypertension. Some clients may have a normal blood pressure in the low range, but if there is a sudden drop from usual, immediately report it to the nurse. Question 43. Normal urine color is A. Red, B. Colorless, C. Brown, D. Yellow. Answer D. Yellow. Explanation. Normal urine has a yellow color that ranges from dark yellow to light straw color. Urine that is amber-colored indicates dehydration. More fluids need to be taken. Brown urine can mean severe dehydration or liver disease and should be checked. Urine that is red tint can happen after the client eats some foods such as beets or blueberries. Red urine can also be a sign of kidney disease, urinary tract infections, or prostate problems. If urine is colorless, it can mean that the client is overhydrated and should reduce fluid intake. Question 44. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient A. ate too much sugar, B. had breakfast, C. had visitors that day, D. had diabetes. Answer B. Had breakfast. Explanation. Diabetic clients have a strict schedule regarding insulin injections and eating. Eating causes blood sugar to rise, and the insulin helps move it to the cells. Without food, the blood sugar drops quickly, causing a serious situation. Immediate treatment is necessary. Quickly check the client's blood sugar and report it to the nurse. The client will need to eat 15 grams of glucose or a simple carbohydrate, such as 1.5 cup orange juice or a tablespoon of sugar. The nurse aide should be aware of which clients are diabetic so that meals are served shortly after receiving insulin. Question 45. Signs and symptoms of shock may include A. Increased blood pressure, bradycardia, and flushed skin. B. Low blood pressure, tachycardia, clammy, pale skin. C. Absence of respirations and pulse. D. Hyperventilation. Answer B. Low blood pressure, tachycardia, clammy, pale skin. Explanation. Signs of shock include low blood pressure, hypertension, a rapid heart rate, tachycardia, a weak pulse, and pale skin which can be damp or clammy. The client may also be breathing rapidly, hyperventilation. The client may also be confused or not alert. Shock is an emergency situation requiring rapid treatment. Question 46. A resident with an ileostomy evacuates feces through the A. Jejunum, B. ileum, C. colon, D. anus. Answer B. Ileum. Explanation. The ileum is the lowest part of the small intestine. An ileostomy is an opening in the abdomen that is made during surgery. The end of the ileum is placed outside the body and connected to a bag that collects the waste of the intestine. It is usually on the lower right side of the body. Question 47. The safest way to confirm a resident's identity is A. Check an ID bracelet or tag attached to the resident. B. Look at the door number and compare to your room list. C. Call the person by name and see if they answer. D. Ask the resident's roommate. Answer A. Check an ID bracelet or tag attached to the resident. Explanation. Accurate identification of a resident is always done by checking the resident's ID bracelet or tag. This is a universal standard of practice in every facility and healthcare setting. It ensures that the resident receives the correct treatment and care every time. Question 48. On what side should the patient lie for an enema? A. The side closer to the restroom. B. Right. C. Left. D. Whichever side is more comfortable. C. Left. Explanation. The left Sims position is used for rectal examinations and administering enemas. The client lies on the left side, with the right knee and hip bent. It is also called the lateral recumbent or semi-prone side position. Question 49. The circulatory system consists of the A. Blood vessels, arteries, veins, and capillaries. B. Heart, aorta, pulmonary vessels, lungs. C. Heart, arteries, veins, and capillaries. D. Blood vessels, lymph nodes, spleen. Answer C. Heart, arteries, veins, and capillaries. Explanation. The circulatory system is made up of the heart, arteries, veins, and capillaries. They are connected to make a complete circuit in the body. The heart pumps oxygenated blood from the lungs, as well as nutrients, through the arteries to the capillaries. The capillaries then deliver carbon dioxide and waste to the veins. The veins take the waste products to the liver and kidneys for disposal, and the carbon dioxide goes to the lungs to be exhaled. Question 50. Who orders a warm or cold application? A. Director of nursing. B. Doctor. C. Nurse. D. You as a CNA can if you think it is necessary. Answer B. Doctor. Explanation. It is important to remember that only a doctor can order a treatment, test, or medication for a client. This includes simple treatments such as hot and cold compresses. A nurse aide can be fired or lose certification for initiating treatments. Thank you for watching.